The next procedure to be done is carving the pattern for a finished dentures. That's sometimes called festooning, in that the little carvings that we place into the wax to form contours around the teeth, simulating root eminences and interdental papilla and all of this sort of thing, is known as festoons. What we're going to be doing is festooning, or carving the wax to make it appear to be natural gingival tissue as much as we can, as far as contour is concerned. I usually start that procedure by removing the dentures from the cast, and with a number 2 lead pencil mark the internal edge of the land area, which would be the external limit or parameter of the tissue surface, the edge of the impression, in other words. Even on the lingual, you can do the same thing by marking that edge with the pencil. Now when we get this all covered with wax and we start carving the wax back, if we carve it to the point to where we can see the edge of the pencil line, then we will know how far we want to carve the wax back in order to record all of the periphery in our finished denture. And we can do the same thing on the maxillary, and I'm going to start that by marking the posterior limit of the posterior palatal seal, and that's this mark right here. And we can mark that, and we can come around the buccal of it and mark the external edge of the tissue surface. We want to place the dentures into full occlusion on the articulator, and I'm going to loosen the pen and make sure that I hold them in full occlusion. And as I do that, I want to take a hot spatula and I'm going to seal each of the dentures to the cast so that I can remove the cast from the articulator and be able to work on them out in my hand without fear of the denture being displaced from the master cast and not being placed back onto the cast in the correct positions. Once you've done that, we can remove the dentures, the master cast, and the mounting from the articulator, and it's just a lot easier to work with if we have them out in our hand. All we'll need to do with the articulator from this point on is to put them, after they're festooned, put them back on the articulator to establish, to make sure that we have not upset the occlusion in the process of festooning. Now, as I want to finish sealing down the dentures, the trial dentures, to the master cast. We've done it in parts, but we still have some open spaces. So we're going to finish sealing them down to the cast. So now that we're getting them sealed all the way down, we're about ready to start adding a bulk of wax to the dentures in order to give us something to carve, in order to form the proper contours. The aesthetics of the dentures is established with the position of the teeth, not with the base material. On the facial surfaces, from the gingival edge of the teeth to the edge of the land, or the periphery of the denture, that surface should be slightly concave, never convex. It may be almost a straight line in some places, particularly in the labial regions. And I like to use the number 31 spatula, which is this large boat paddle looking type of spatula, to add wax. And what we're going to do now is just add enough wax to this denture base to be able to carve the festoons into it, and to carve the root eminences, and to carve the pattern for the base part of the denture. I usually do that by starting to add over the tuberosity from the edge of the last tooth down through the periphery a little dam of material, building up a bulk of material in this area, right down from the tuberosity, usually just on the buccal side of the tuberosity, and add just a little extra bulk to form a dam in that area. Then come around to the canine. and you want to add a dam right at the canine region and let it come from up onto the tooth through the periphery. Just a beading of wax build up along there, or maybe a millimeter or a millimeter and a half thick at the gingival collar of the tooth, and then coming down through the periphery, just a little dam of material like so. And come around to the other side, we'll add a dam of material over the other canine. This is the starting of adding enough wax to give us some idea how much wax we need to add, number one. And number two, this is the starting of adding wax to form a root eminence over the teeth. So we've added it on both canines and one of the tuberosities, and as that wax congeals a little bit, we can manipulate it some, and we want to add wax for another dam down the tuberosity region. And once we have that wax added like that, and that congeals just a little bit, it's no longer going to move on us. And once that occurs, and we allow that wax to set just enough till it doesn't move, about like so, now we can come around back to where we started with it to begin with, on the opposite side now, where we first started with it, and I'm going to fill in the space in between the canine eminence and the tuberosity. As you do that, let the wax come up onto the teeth just a little bit and into each interdental papilla. And as you flow wax into the interdental papilla, make sure that you have your spatula nice and hot, and place that hot spatula down into each interdental papilla. The purpose of that is to make sure that you have put enough wax into the interdental papilla and that you have eliminated air bubbles. If you get an air bubble, particularly in an interdental papilla area, it's very difficult to carve the wax and make it look the correct contour. So we just smooth off that wax that we've added now to the buccal, and as you can see, it comes up onto the teeth, about halfway up the teeth and down through the periphery, and just enough thickness wax to give us a millimeter and a half or so of wax at the collar of each tooth. We can do the same across the labial region now between the canines. We've added canine eminences, and now we can add wax across this labial, up onto each tooth, and into each interdental papilla area. And let the wax just flow up onto the teeth, and it'll be up onto the teeth by a millimeter or so, or halfway up the tooth sometimes. That's okay. And let that wax flow up onto the teeth, and then with a very hot spatula, once you have that bulk of wax added, go into each interdental papilla and make sure that you haven't trapped an air bubble. And we can smooth that back out. And now we're ready to come on around to the other side and add wax from the canine eminence back through the tuberosity to each posterior tooth. Now across the palate, we don't want to add too much wax. We would like our finished thickness of our base material from this external surface to the cast to be somewhere between 2.5 and 3 millimeters. If you have pretty good control over the base plate as you made it, as to the thickness of it and its adaptation, then you generally don't have to add any more wax over this palate than just enough to give you a good finished surface to it. A good way of doing that, if you have any doubts about how much wax to add there, is before you ever seal them down, drill some holes and see what the thickness is. And as you start adding wax, you can measure and see just exactly how much you need in order to get that 2.5 to 3 millimeters. Again, along the collars of each tooth on the lingual, I want it a millimeter or so thick, and then let it flow from there gently into the palate to form a very nice, smooth surface, constant contour across the entire palate. And we'll flow just enough wax on these anteriors to make sure that we don't leave any little ledges of tooth structure along that area. And we're going to flow the wax across the palate now, the palatal portion of the teeth, right up against the teeth. We have a nice smooth contour. Add just a little thin layer of wax. You don't want much, just enough to be able to contour it as you finish the wax out. What I like to do with it is to take a knife, such as a Buffalo 7R knife. It's probably my favorite knife for laboratory work, and clear the land area. We do that just by scraping any wax off that has creeped down onto the land area. So we're going to clear the land area all the way around, getting rid of as much excess wax as we can. I want to smooth that wax in its present form. I'm going to do that by use of an alcohol torch, the hand-out alcohol torch with a nice pinpoint flame. And if we get a nice sustained pinpoint flame and brush the wax that we've added to that just to get it somewhat smooth. I'm not looking for contour at this point. I'm just trying to smooth the wax and get it to a state that will be easy to work with when we start trying to carve the contour into it. So we're just smoothing the wax. Hand area. Let's set that one aside now. And all we're going to do is set that aside and let that wax harden. It's very difficult to carve that wax as long as it's extremely soft. And with the wax that I'm using to dip, the wax supply I'm using to dip molten wax out of, while I was doing the maxillary, that wax has hardened up somewhat, so I'm just going to soften it back up by placing the container back in the flame, get a nice pool of molten wax into the container. We're going to do much the same thing as we did on the maxillary arch. I'm going to start with placing a little dam from the distal of the last molar across the retromolar pad. We can do that on both sides, from the distal of the last molar across the retromolar pad. And as we do this now, we're going to seal it and make sure that we have sealed it all the way. Once we have those dams across the retromolar pad, we're going to build a little root eminence now onto the canine. Check and make sure it's sealed all the way. And now we're going to flow wax between that retromolar pad dam that we build up of wax. Flow wax between that and the root eminence that we build up for the canine. And again, flowing enough wax to get a bulk of wax that will give us maybe a millimeter to a millimeter and a half thickness of wax at the collar of each tooth. And let that wax solidify just a little bit. We can add the canine eminence to the opposite side, just like we did on the left side. We come over to the right, add the canine eminence. And once we've done that, we can flow wax now between the dam that we placed at the retromolar pad area and the canine eminence that we just added. Flowing wax to get a bulk of wax, be able to carve our proper contours. Take a very hot spatula and go into each interdental papilla and make sure that you haven't trapped air in there. Move it around to the labial region and add wax from the periphery and the labial region up onto the teeth between the two canine eminences. A little air right there, so if you take a hot spatula and go in there, we can eliminate that air. The lingual, and on the lingual, we're going to make sure that it is sealed all the way across the retromolar pad area and all along the lingual. It's totally sealed. You can have no areas of the periphery of that denture that have not been sealed to the cast. It must be sealed. Now we can add wax on the lingual surface from the teeth around the interdental papilla areas. And smooth that wax with a hot spatula and seal it real well into each interdental papilla and smooth out till it's about a millimeter thick where the wax is joining the tooth. Allow that to solidify just a little bit. Now we'll go to the opposite side. Across the labial, or the anterior portion, the lingual parts of the anterior teeth, just make sure that you have enough wax that flows all the way up to help form part of the cingulum of each of those teeth. We're going to clear the land areas once again with the number 7 spatula, or the 7R knife rather than a number 7 spatula. So we clear the land area all the way around, just like we did on the maxillary. And now we're going to take the Hanau alcohol torch once again and smooth the wax. Now we can set that trial denture, the lower, we can set it aside, go back to the maxillary denture now. You'll find that number 7 wax spatulas come in 2 varieties today. The beaver tail part of it is about the same in all varieties. It's nice and rounded, and it's perhaps 5 millimeters in width, and nice and rounded and sharp. The pointed end of the number 7 wax spatula in outline form from here is about the same, in that it is a sort of spear shaped with a real sharp point on it. If you look at it in cross section down the end of it, some of these have both sides of this pointed area, the spear end of it, both sides are rounded. Others of them have one side rounded and the other side flat. I prefer the one, personally, the one that has both sides rounded. I find it easier to work with. Though. But this instrument can be used in carving the festoons, and I used to use this exclusively for carving festoons, and the way we would do this is to point the instrument at a 45-degree angle, like so, with the surface of the tooth, and you can roll this instrument like this as you carve, and we start with the instrument pointing at an interdental papilla. We find the junction of the collar of the tooth and the clinical crown of the tooth and roll the instrument as we come around and let it point up into the next interdental papilla. Point it up into the interdental papilla, and as you come around feeling for that collar, a junction of the collar and the clinical crown of the tooth, let the instrument roll till it comes up into the next interdental papilla. I found in recent years that my hands hurt quite a bit, perhaps a bit of carpal tunnel syndrome going on with it, and I found that the larger the instrument I'm holding on to, the less tendency I have for the pain in the hand. So I've gone to using a number 7R knife, a buffalo plaster knife, and that works quite well also for festooning, if you do it well. This way I don't have to hold on to something so small. So what you do is point the knife up into the interdental papilla, and as you feel for that collar, roll the knife as you come around and let it point up into the next interdental papilla. Point it up into the interdental papilla and let it roll. And as you come around, you're feeling for that junction of the collar of the tooth and the clinical crown of the tooth, and let it roll into each interdental papilla as you come around. We do this around each tooth, around the entire arch. On the palatal side, come in at a 90-degree angle and down about 4 millimeters from the occlusal surface of posterior teeth. Just make a clean cut and let it go into each interdental papilla. Straight around and into the interdental papilla, straight around and into the interdental papilla, and so on. As we come around the anterior teeth, you want to feel for the junction between the cut or the prepared or manufactured lingual surface of that tooth and the finish line of the tooth. That would be actually in reality about the middle of a cingulum on natural teeth. So what we're going to do is we're just going to carve it to that junction between the manufactured finish line on the tooth into an interdental papilla at about a 90-degree angle around each tooth, and then right on back through the posterior teeth. And we're going to remove all wax above that cut, buccal and lingual. If you allow this wax to harden, the harder the wax is, the easier this removal of wax becomes. And we want, the object is to clean every tooth now above the cut line that you've made. Clean it to get all remnants of wax above that cut line off. Move along with it. So we don't like to water polish these at all. We're going to avoid putting these in water any more than we just have to. So we're cleaning it above the cut line now of all remnants of wax that we can. And on the facial now, this is more dramatic on the facial because you can begin to see the festoons occur and see interdental papilla being carved and taking some form as you go. As you clean this off now, and if you've done a good job of that cut line that you made to begin with, you'll begin to see the form of the denture pattern taking place. You'll begin to see what appears to be a gingival line forming in the denture pattern. And remember to clean those teeth as best you can and get rid of as much of the wax as you can above that cut line. You'll see some little remnants of wax or flakes of wax. And what I like to do to get rid of those is to take a good stiff brush, and a denture brush works well for this, and brush it just to get rid of any little flakes of wax that you haven't been able to just peel off with a knife, to help you get rid of those. As you do, you're going to notice some other areas that still have some wax on them. As an example, in the buccal groove of this first molar, there's wax, see? So we're going to get rid of that. And now that we've cleaned it as best we can, we're ready to start carving root eminences into the teeth. The carving of the root eminences, the instrument that I find works best for that is the beaver tail end of this number 7 wax spatula. That's the large end of that number 7 wax spatula, makes for a very nice carving instrument. It's fairly sharp if you have a good instrument. And what we do with it is at each interdental papilla, start on the interdental papilla and carve a groove, vertical groove, about at that depth, maybe a ½ millimeter deep, from the interdental papilla right on through the periphery at this point. But that's only through the periphery at this point. We're going to eliminate that in our further carving. And you want to put that groove between each tooth, and we're starting the carving now of root eminences onto the denture pattern. Once you have those vertical grooves carved like so, they're rough at this point, very rough. In order to tone them down so it just doesn't look like a series of hills and valleys that's very rough, in order to tone them down, do horizontal carvings with the same instrument. And you can do that just by horizontally carving on the wax, like so. I usually like to fairly well eliminate those grooves from about halfway up the pattern to the periphery, so that it's just smooth from halfway up the pattern to the periphery, and you have just a hint of those root eminences left on the tooth side, or the lower half, so to speak, of that pattern. After you've done that, it still looks very, very rough, and you'll find that you have some wax flakes that come up on the teeth, and you want to clean all those off, like here. Go back to your hand-out torch again now. And with the hand-out torch and a nice sustained flame, brush the wax with the flame to let the flame itself smooth the wax. Do the same on the palate. Let the flame smooth the wax into a nice smooth pattern. Now I like to go back at this point and clear that land once again and look for just a hint of that black mark that we started with that told us, that you can see that right along in there, that told us where the external edge of the periphery should be. And at this point we want to look and see what we have at this point. And what I see is basically some imperfect interdental papilla that I want to work on just a little bit. And we can do that by recarving those papilla now. I like to do it by taking the sharp edge with a squared off edge on the number 7R spatula, or 7R knife, lay it against the tooth, and let that sharp edge help you redefine the crest of the gingiva and where it joins the tooth itself at the collar. And as you do that, on each tooth, scrape off any wax remnants that are up onto the tooth. One of the mistakes that I see students making trying to do this is they try to use the wrong instrument. They like to use, for some reason, a Hollenbeck carver or Peter K. Thomas instruments, and they're great for crown and bridge, but horrible for a complete denture, mainly because they're just too small. All you do with those is form little scratches in the wax. And all we're doing basically now is just sharpening up that crest of the gingiva around each tooth and removing as much extraneous wax above that cut mark as we possibly can. Just come around the lingual again and sharpen it up just like we did before, redefining that line or demarcation between gingiva and tooth. And take my brush like I did before, brush away any extraneous little flakes of wax, and take the hand-out torch once again now and just very gently brush it with the flame to let the flame form the finished surface for you now. If this is well done, at this point what we should see with it is, number one, we should see just a hint of the black mark that we started with, which gave us the line of demarcation of exactly how wide the periphery of the denture should be. We should see a very nice line of demarcation between the wax and the tooth itself, being very sharp, and no flowing of wax from this line of demarcation up onto the tooth. It should be very sharp, and everything above that line of demarcation should be clean. We should see hints of root eminences, and as you look at these, you can see just a hint. You want to take your finger and sort of polish it just a little bit with the oil on your finger. Makes it show up a little bit better. And you can see a hint of a root eminence, a hint of a root eminence, a hint of a root eminence. And it is not a long ridge separated by deep grooves. And it's just a hint. And that root eminence generally will extend about halfway between the tooth and the periphery of the denture. In other words, about to there. Then from there on, it'll be smooth. If you look at this in cross-section this way, this surface from here to here should be at least straight, and if possible, slightly concave, but never convex. Now, we have a pretty decent looking pattern of that maxillary, and we need to carve the mandibular pattern now. So we're going to set the maxillary aside now. We're going to do the same thing with the mandibular pattern. 7R knife, first of all, and clear the land area on the lingual and buccal. Just clear it once again. Get rid of any wax that's in our way. It's not in too bad a shape on the buccal. Clear any of this wax away. And now we're going to start carving by starting at the distal of the last molar, and we're going to carve it feeling for that junction of the collar and the clinical crown of the tooth. There's a little groove there that you can feel. And that's where it needs to be carved, is right to that groove. And we do that around each tooth. And you'll find on the mandibular, you usually do not have enough length to the denture base from the collar of the tooth to the periphery to worry about root eminences. Sometimes you'll have one that's long enough that you can work with root eminences, but for the most part you're not going to have that. And we're going to round the lingual just like we did on the maxillary, come in just below by maybe 3 millimeters or something like that below the occlusal surface of each tooth, and carve a line around the anteriors at the junction of the prepared surface of the denture tooth and that finish line. Just carve the wax back to that finish line. And now we're going to remove all the wax above our cut mark. Let's start over here. Being right-handed, that's a little more convenient, so we'll go this way with it. And just remove all the wax now above the cut mark. Clean it as we go, as clean as we can get it. As much as we possibly can, get rid of all little flakes of wax and any wax that's flowed up onto the tooth. Clean the teeth real well. Do the same on the lingual now. Now we got it fairly well cleaned up. We're going to take a brush, get rid of any little flakes of wax that we can by brushing. They just flow up onto the tooth as a film. So once we have it carved and cleaned up fairly well, we'll smooth it out. And now we're going to worry about the contours area, so you're not going to get much in the way of root eminences, but we do need to worry about the contour, and we would like as many of these surfaces as we can get them to be concave. So we're going to take that large end of the number 7 spatula and carve enough wax off just to make it a little bit on, wherever we possibly can, make it a little bit on the concave side. Same is true on the lingual. As much as you can, make them concave. And we're going to flame it once again and let the flame create the smooth surface for us. What we're going to do now is just sharpen up any of these junctions, like right there, sharpen it up. Get rid of all the wax up onto the teeth. Any of the extraneous wax that might be in those interdental papilla. Right here, we got wax on the occlusal surface, so we're going to get rid of that. Come around the linguals the same way as we did on the maxillary. Clean them up once again. And particularly on these lingual surfaces, the lower anterior. That's probably the area where students tend to neglect it more, and they leave wax on those teeth a little more than we would like, right? And once you've cleaned them, we'll go back with the brush once again, Make sure we get rid of as many of the flakes of wax as we can. And then take our torch and smooth it back out. Any areas that might be rough, let the torch do the work and do the smoothing for you. Good shape on this lower. I'm right pleased with it, the way it's turned out. And again, looking at it, this surface here and here, those surfaces should be slightly concave. The reason for that is as the tongue lies in here, if those surfaces are slightly concave, it forms a sluice way for the tongue to rest the tongue in that area, and it helps seat the dentures. On the buccal surfaces of it, all the facial surfaces of both maxillary and mandibular, if you have that surface concave in this area and this area, the buccinator complex of muscles folds in on it and will tend to seat the denture. If you have it convex, it will tend to unseat the denture. At this point, what I like to do is to place them back on the articulator and make sure that we have not disturbed the occlusion. A fairly close proximity of retromolar pads to tuberosities, you may have a wax or a base plate interference. I usually, if we have a base plate interference at this point, will leave it alone until after processing before I try to correct that. If I don't have any interference, then we can check and see how occlusion has turned out. And it appears as though we have not changed the occlusion in any way from what we started. And that concludes our wax pattern now. Next procedures from there will be to process the dentures and have them ready for a patient delivery. Okay.